Knock, knock. Hi, excuse me. Yeah, I'm sorry, that medication's on back order. Oh, no, I'm a med student. I'm supposed to be shadowing you today. Oh, I'm sorry.
I've been wanting to react to this creator for a long time. I love him. I think he's an ophthalmologist and he does a bunch of funny skits. And this one's about a pharmacist, actually a hospital pharmacist, and he is acting as a medical resident who is shadowing a hospital pharmacist. So I thought it was fun and funny to react to this. So he comes in and he tells him, without even looking at the pharmacist, says, "I'm sorry, the medication is on back order." That's typical, right? So what that means is a medication is not available for purchase from the manufacturer because of some kind of issue with the production, right? Whether it's a controlled reason, like due to contamination of the product, or for example, the back order issue that happened years ago was back in 2017, 2018. I was actually in residency at the time. There was a big hurricane that hit Puerto Rico, and they're responsible for supplying us with all the small volume bags of fluids of normal saline and dextrose, and those were on back order for a long time. So the pharmacy department had to come up with a plan on how to mitigate that, on how to make sure our patients were still getting all the medications they needed, and we had to find a plan for that. But medications go on back order all the time, all the time. And so this is a common thing. Usually when a provider orders something and they get a phone call from pharmacy right away, it's because there's an issue, usually with the production or the supply of the medication. So that's what this is in reference to.
Oh, I'm sorry. Force of habit. It's fine. Please come in. I'd offer you a chair, but pharmacists are contractually prohibited from sitting down. What are all those marks?
So another reference to pharmacists being contractually obligated to stand. This is in terms of community pharmacy or retail pharmacy. They typically stand, pharmacists stand behind the counter, right? And the physicians stand. I don't know quite why that is. I don't know. I think it's just culture. But in the hospital, we don't stand. I mean, I stand when, or I walk around when I round, but I typically sit at my desk. But that's what this joke is in reference to.
Hmm? Oh, the tally marks. Yeah. That's how many patient lives we've saved. Wow, that's a lot. Yeah, not bad for a week. Tony, you got another one.
So you see all those tally marks on the back whiteboard. Pharmacists are known for documenting, keeping track of things, and actually being in the hospital, I am required, as my job description, to keep inventory or track of all the interventions that I make. So he says these are all the lives we saved. Well, that's a joke. We're not maybe necessarily saving their life by that one intervention, but we're definitely preventing an error. We're definitely discussing something with the provider. Maybe we're just monitoring something. We're not necessarily adjusting anything, but we're aware of a potential risk and we see if there's a benefit. But we do document a ton of stuff.
Yeah, boss. Somebody ordered 100 milligrams of Dilaudid. Nice catch. Put it up on the board. That's Tony. It does great work.
So 100 milligrams of Dilaudid or hydromorphone is absolutely insane. Typical dose is as low as 0.25 milligrams to 2 milligrams per dose. So 100 milligrams is probably like an error in entry of the dose. A lot of times, actually, the keyboard will stick and the provider will accidentally enter extra zeros. I assume that's what happened in this case. Unlikely that this will ever get given to a patient. That would be absolutely insane. Usually if a nurse was to go and pull this medication out of the dispensing cabinet where they're stored, she would probably, or he would notice that there are many vials required to supply this dose, and they would know not to do that, right? They would know there's an error with the medication, but pharmacists catch this type of stuff all the time. And it's usually just order entry errors, right?
What does that sound mean? You hear that sound every time a doctor does a med rec incorrectly.
So a med rec is short for medication reconciliation. This is actually one of my responsibilities when I was working in the emergency department. It's really common for ER pharmacists or technicians to do this. It is basically obtaining a list of patients' home medications upon their admission to the hospital, and then ensuring they're entered into their profile so that we can continue them while they're inpatient if appropriate, or to potentially identify that some of them are causing some of the side effects or some of the symptoms that brought them into the hospital in the first place. So providers, unfortunately, are known for not doing as great of a job with medrecs as pharmacists and pharmacy technicians are. So, you know, it's a funny joke with the little noise, wah, wah, right? But we do usually have a role responsible for doing that. Nurses can also do it as well after hours.
Do you have to page them to try to fix it? Nah, it won't do any good. It's probably a to-go order, which is when doctors put orders in and then immediately leave the hospital with no way to get a hold of them. Knock, knock.
So that final joke is more on the doctor than the pharmacist. You know, some doctors are unfortunately notorious for entering a ton of orders. They'll drop an order set, is what we call it, and leave the hospital, right? They're done. They saw their patient, they put in their orders, and if there's an issue with it, well, you know, usually there's always somebody else on call. There's a way to get a hold of them. There's nurse practitioners or physician's assistants that will assist those doctors, so sometimes they will get the call, but that does happen sometimes. Sometimes it is hard to reach a patient or reach a provider to discuss a patient. I love this creator. Shout out to him. It's Dr. Glaucomflecken. I think I got that one right. Just say with confidence. That's what I tell my pharmacy students when they try to pronounce hard medication names. But I hope you guys enjoyed this.